So another huge group that I think we are all aware of in our country is our military population. And I'm here with Brooke today to talk about our veterans in our community. I think it's a safe assumption to make that access to resources in general is a challenge, whether it's finding a provider or being on a wait list for 6 months. And thinking about those who have been trained, have been deployed, or even have been injured in the line of duty. What are some common challenges that veterans bring into the therapy room or that veterans face every day?
Yeah, so there are a couple things that come to mind with that question. Where are they at in their service? Are they, active duty or reserve still in the military? Are they out of the military? Because there's challenges, I think, on both sides of that. If you're still in, you have a chain of command that you have to report to, and you have to be accountable to your job. Accountability is so important, right? If that person's not filling their role, who's going to fill in, right? And so when you talk about mental health services and therapy services, you might have access to maybe the clinic on base or on post, but you're not going to be able to access community resources as easily. You might not have permission to, and then you have to think about privacy too, because if it's found out that you're struggling mentally and not able to perform, there could be some consequences to that, some pretty significant ones. So the stigma is definitely there for sure. And then accessing the services out in the community, like you were saying, wait lists can be difficult. So what comes to mind as I think about this question is an organization that I've gotten involved with years ago, a nonprofit called Give an Hour. It's an amazing organization that I'm so glad I learned about and decided to become involved with. Essentially, Give an Hour, the core of its mission is for licensed therapists like myself to give an hour of their time to a service member. They can be still in the military, they can be out of the military, but that also extends to their family members too. So that's really great that therapists are donating their time completely free to the military community so that they don't have to worry about that accountability piece that I was talking about, that they can get completely confidential services, not worrying about if their job's going to be in jeopardy. And then also their family members who might be struggling with things that's going on for them, they're not near their support system, that they can have access to those resources and get the help they need to.
That sounds like a wonderful organization. So we'll be sure to link that too for other people to know about as well. And you're bringing up a really great point that I guess I never thought of, is the difference between being active versus being retired or being veteran status. And so if we're thinking about veterans in general, is it hard for them to ask for help too? And what's important for us to know regarding this?
Yeah, I can't speak for the whole community, but I will say just from my background, professionally and personally, it can be difficult. They get trained up really well, and they're very amazing at their jobs. And there's that's so important, but they don't get trained down. So asking for help is very contradictory to the mission first, meaning I am going to do everything I can to get the mission done. That could even mean the ultimate sacrifice of giving their life for their country. So the whole idea of asking for help for personal gain or personal reason, the concept of self-care can be really foreign to them. So being patient is going to be important. I'll say, sitting in the therapist chair, just acknowledging that if I have a veteran that I'm working with and they're in therapy, that's amazing. But being patient in that process, knowing that the mission first is something that they might still very much identify with.
Do you think that family members or support networks in general may notice that a veteran may need support before they're self-identifying that?
Oh, definitely. Yeah, I would say so. Mm-hmm.
Okay. And so leading into that kind of question too is, how do service members transition to civilian life? Is there support offered? I love kind of that language you use, that people are trained up, but not necessarily trained down. And so what about veterans who may move outside of military communities, and what are barriers to their transitions?
Yeah. That's a good distinction to look at if they're staying in a military community, or maybe they're relocating back home, which wasn't a military community, when you're leaving that phase of your life where maybe you were spending so much time with other service members, other military families, finding where you can fit into a more civilian population can be a challenge. You don't have the same supports perhaps that you did when you were serving. So that's important to acknowledge. There is some programming out there to help with the transition, but I think more can always be done. If you think about someone perhaps who enlisted when they were 18 and maybe they had a training accident or they got injured in some way and now they're not able to work or returning to work doesn't make sense for them in the civilian side of things. Being, 24 or 34 years old now facing medical retirement isn't something you're always prepared for. And so that's where getting some support, talking about that in therapy with trusted family and friends can be really important.